Alright, I'm Hannah. I'm going to be doing my blood administration video. I have John Reed behind the camera and she's going to do a 360 scan of the room. Alright, I'm going to begin now. I have Betty Jones as my patient with the birth date of 5/21/52. I have her doctor has gave me an order that she needs to receive 2 units of packed red blood cells, so we are going to go do that.
Hi!
My name is Hannah. I'm going to be your student nurse today.
Hello there.
I'm going to provide privacy. Can you give me your name and date of birth?
Betty Jones, date of birth of 5/21/1952.
All right, that all matches up, Betty. I'm here to get your blood transfusion started. Do you have any questions?
I don't have any questions at the moment.
All right, I see the doctor has came in here and talked to you about the procedure. I see you both signed the consent form, so I'm going to assume then that means that you don't have any sort of religious beliefs that would prevent you from receiving the blood product today.
That is correct.
All right. Before we start, I'm going to talk to you about some of the reactions that you might have. There's a lot of things that could happen, so it is important that I know when these are happening. So if you suddenly feel like you have the chills, headache, body aches, shortness of breath, a rash, hives, if you start feeling anything out of the ordinary, it is important for you to tell me this so that I know and I can come in here and fix the problem.
I can do that.
All right, sounds good. So while I'm waiting for our blood products to come up from the lab, I'm going to quick assess your IV site. I check my saline flush, and it's still within the expiration date. I'm going to get the air bubble out. And clean off the port. And attach. Do you feel any pain or pressure as I'm flushing your IV tube?
I do not.
All right, that's good. Also, while I'm here, I'm assessing your IV site. I'm looking for any redness or swelling, any puffiness, but I don't see anything, and that's good. Dispose of my saline syringe. Wash my hands again. I'm going to make sure to get a good baseline of vitals, just so that we know if anything changes during the procedure. So I'm going to get your pulse, your blood pressure, lung sounds, heart sounds, and your O2 sat. All right, I got those, and it looks like my blood is here now.
Hi.
Hello, John Reed.
I got the blood.
All right.
Here you go.
All right, let's quick do our blood checks.
Oh, yeah.
I have Betty Jones with a birth date of 5/21/1952.
Betty Jones with a date of birth of 5/21/1952.
All right, I have a med record of 224466.
Medrec number of 224466.
Account number of 123456.
Account number of 123456.
A red armband of 456654.
Red band number of 456654.
I have a patient blood type of B positive and donor blood type of O positive.
Patient blood type of B positive, donor blood type of O positive.
All right, and I see that the compatibility test has been completed. I also know that a person with B positive blood is okay to receive O positive blood as well. I also have a donor pool number of 7890 and units in the pool of 4.
Donor pool number of 7890, units in the pool 4.
All right. And then an expiration date and time of 12/17/23 at 1500.
Expiration date of 12/17/23 at time 1500.
All right, that all checks out, and we're both going to sign the checklist.
Okay.
All right. Now then, Betty, I'm going to start by just getting your IV line primed with normal saline. And it's important that we only use normal saline when we are using blood or blood products. Checking my tubing. It's in the expiration date. Making sure all my clamps are closed. That's good. Looking at my normal saline. I am good within the expiration date. I don't see any damage to the bag, and I see that the fluid is all clear with no sediment or debris inside. Going to untangle. And spike my normal saline. Now it is important to fully prime my IV line so there are no air bubbles. Okay. There we go. We are now fully primed. And to make sure that I fill my drip chamber to above the filter to prevent any of my blood from lysing on impact. Alrighty. I'm going to lock my saline and hang my tubing over the machine for now. Now I'm going to look at my blood, invert it a few times, looking to see if there's any clots, gas bubbles, and making sure that it is a nice red color. We will now uncap and spike the bag. Okay, make sure my clamps are locked. Up. Now I'm going to let my red blood cells prying through the bag. And I want it so then I have red blood. I have blood going all the way through my tubing. So this line and release my roller clamp. Take it off. Now I'm starting to see a pink tinge go through my tubing. Alright, we will clamp it off and get ready to start setting up my tubing. First, I am going to clean the hub again. And attach, keeping my tip sterile. Alright. It's also important that I make sure that I keep my blood ready to go right away, so then because blood products can only remain at room temperature for about 30 minutes. Wash my hands. And then we will get my pump set up. Yes, new patient. Channel select. Guardrail IV fluids. And we go to B for red blood cells. Double check my order, that it matches my order and what I have hung currently. Yes, we want to start at a rate of 50 milliliters per hour initially, and I can change it as well as the patient tolerates. And volume to be infused, I am going to start with 240 milliliters. Less than the 250 that I have in the bag to make sure that I am present when the bag is emptied and done, so I don't end up having an error in my line. So I will press start. Make sure I unlock my tubing. Making sure it is flowing. Now, as it's going, I'm going to make sure that I keep my normal saline locked during the time that the blood is infusing. I'm going to stay in the room with the patient for the first 15 minutes so I can monitor for any adverse reactions. I'm also going to get vitals at that 15-minute mark, then half hour later, and then every hour based on facility policy. Any lifespan considerations would also include if the patient is smaller, like a child, or has a history of heart failure, they are at a greater risk of fluid overload, and I want to make sure I monitor that closely. Make sure I listen to lung sounds to make sure there is no fluid buildup. But yeah, so that's going. I want to make sure that my blood is infused within a 4-hour time limit altogether. Otherwise, if it, for whatever reason, takes longer than 4 hours to infuse the blood, I would make sure that I change out the tubing. I also want to make sure that words are failing me right now. I make sure that I'm checking vitals regularly and assessing for signs of any sort of reaction. If a reaction does occur, I immediately want to stop my infusion and notify the provider. Depending on what reaction it is, it will change my actions, but that also can depend on facility policy. So we'll say that now it has been, the transfusion is complete, and I am going to quickly pause, clamp off my blood, and open my saline and reprogram it for a normal saline infusion at the rate that it was previously infusing. And I want to infuse about approximately 50 milliliters to make sure that I flush out the tube of any leftover blood that remains. So after that is going, and after my tube has been flushed, I am going to disconnect everything, make sure that I put my empty blood bag and tubing into the biohazard, flush the IV site once more to maintain patency, and then I will make sure my client is safe and comfortable and get one more set of vitals. And then after that, I will document the vitals, all the checks that I did with my blood, so the record number, account number, name, date of birth. I would document the IV site, the blood that was used, the saline that was used, and how well the patient tolerated, and any actions that, if they occurred. All right, that completes my thing.